Hello and welcome to today's Self-Care Summit Learning Session, Health Transformation and the Role for Retailers. You know, healthcare delivery will be forever changed by COVID. New delivery models and patient expectations are here to stay, which create new opportunities for retailers to play an expanded role in their customers' lives and health journey. Joining me today is Rhody Wing, partner of Kearney, and Katie Rowan, principal at Kearney. Both of them will take us through the discussion of this transformation and the role retailers can play. So I'm proud to just welcome Katie and Rhody. And Rhody, I will turn it over to you.
Perfect. Thanks, Keith. Let me just pull up the presentation for everyone. Perfect. Good. Hopefully you can see it. So we're excited to talk to you today about health transformation and really the role for retailers. It's an exciting time for health as it is for retail, as most of this group would well attest to. Both challenges and opportunities abound. Before we jump in, just quick introductions. My name is Rhody Wing. My pronouns are he, him, his. I'm a partner at Kearney. And for the last 15 years, I've been working really at the nexus of health and retail, really all around the consumerization of healthcare. These are retailers who are operating in the health space or health companies that want to become more consumer oriented. As I think we can all attest to, our insurance companies, our hospital systems are not the most consumer friendly entities that we interact with. So tons of opportunity there. And that's where I spend most of my time. Katie, would you like to introduce yourself?
Sure. I'm Katie Rowan. I'm a principal in Kearney's health practice. My pronouns are she, her, and hers. I focus on transforming the way healthcare is delivered across the U.S. And similar to Rhody, this means working with provider clients across kind of a variety of sectors, including hospitals, ambulatory clinics, as well as retail clinics as they develop new models and really focus on kind of taking an omni-channel view to telehealth. And really looking at that as one channel through which patients access care.
Perfect. So the thesis for today's conversation is healthcare is transforming. And the reality is, as Keith was mentioning, COVID's transforming it, but it was transforming well before COVID. And just like what we're seeing on the retail side, COVID's been an accelerant. So things are moving much faster. Consumer behavior, patient behavior is changing much faster. And quite frankly, consumer and patient expectations are changing dramatically as well. The good news is this is offering an opportunity for retailers to really step in and play a new role and to be a partner in the health of their consumers, their customers and patients, and deepen and really expand that engagement with your brand, your retailer, your products, your solutions. So that's what we'd like to talk to you a bit about today. As we talk about the conversation, we'll start with a little bit more on the healthcare consumer, who she, he is, and what they're looking for, opportunities where we see retailers, being able to play a role, and then really a few case studies to dive deep into some of the more interesting and emerging things we're already seeing in the marketplace. So the healthcare consumer. The reality is this is us, and what we've seen and tracked over the last, I'd say, 10, 15 years is really people starting to shift their view of health, moving away from, this is, a big, black box that I know nothing about. I go see my doctor, they tell me what to do, and then I leave, to something that's much more akin to a consumer decision. And that's because of the proliferation of information, as well as interest, as well as lifestyle, as well as health challenges that we're all facing. And so all of those forces are coming together to make the way we think about health and healthcare much more like a consumer decision than it was historically. And the good news is, or not good news, the challenge is that's really important. As we look at the health of Americans across the country, there are real issues with chronic disease, obesity, overweight. These are all real challenges. And in fact, I think you're seeing them in the headlines more and more because of the risk factors they pose for COVID. The good news is, as consumers become more oriented in their health, over the last 2 to 3 years, what we've really seen is a shift away from, classic dieting or restriction to something focused much more on wellness, a shift to really a lifestyle change, which is both more effective for managing your health and also more sustainable. And this is really where we see a lot of opportunity, not for just driving engagement, because a lifestyle is a lifestyle. It's about ongoing commitment and ongoing behavior changes, but also because it's going to drive real benefit for our customers, our patients, and our society. The reality is the consumer isn't doing that on their own. It's being enabled by a digital ecosystem. So the digital tools that we all use, the stuff coming out of Silicon Valley, there's a ton of it supporting consumers in this move to a healthier lifestyle. My personal story, so we all have our COVID stories, and I recently saw my doctor, and his perspective was there's two types of people during COVID. There's the people who have gotten healthier and the people who've gotten unhealthier. There's the people who are drinking less, there are the people who are drinking more. And there's a Venn diagram, so there's some overlap there. But my personal health journey is, at the beginning of COVID, I decided I was gonna try to commit to being a bit healthier. I downloaded an app called Noom. I've been using it for 6 months and I'm down something like 45 pounds. So it's been incredibly helpful for me. And that app is all about building lifestyle changes and talking about how do we make choices and what influences our decisions. And so these digital tools are very real and are showing up more and more. Now, the reality is there are a lot of bad ones out there as well. And so the market's going to take some time to refine. But those digital tools are following customers and patients through that lifestyle, into the hospital system, into their doctors, into out of the hospital, monitoring. And the primary goal here, again, is shifting from a healthcare system that was focused really on being an acute solution, right? I have a cold, I was in a car accident, to a healthcare system that's much more focused on keeping people healthy and keeping people well, and getting them to well. And so I'll pass it with Katie to talk a bit more about how that's showing up in healthcare systems.
Yeah, absolutely. Thanks, Rody. As Rody mentioned, over the past few months, there's been exponential growth in telehealth services across all kind of different patient segments. When we think about, kind of the patients who have a commercial health plan or who are covered under Medicare or Medicaid, each of these different segments has experienced exponential growth in kind of their consumption of telehealth services. And the reimbursement model has also shifted. So it's looking like there will be, and while that was initially driven by kind of the COVID-19 changes, that is looking like it will be kind of a durable change that endures beyond the current pandemic. All signs also indicate that the patients are really going to expect kind of a seamless omni-channel experience. As Rody was indicating, this app that's very integrated into his lifestyle. When patients go to their provider, they're going to have that expectation that those types of apps are flowing seamlessly with their health records and other pieces. And so there's a huge opportunity to help providers actually learn a lot more about the patient and integrate those pieces into the care model. And while, we've seen a lot of advances through COVID, oh, sorry, go ahead, you can go back, sorry, Rody. While we've seen a lot of advances through COVID, these telehealth solutions have been in development for years. And, we've really seen kind of just this explosion of use over the past few months. But really, these go beyond kind of point solutions to maintaining really an overall kind of fitness and well-being. And, the beauty of this is if they all come together, there's kind of an amazing opportunity to really manage kind of the end-to-end experience for a patient. You see on the page here support for acute events, solutions aimed at proactive identification and management and delivery of care, and really in a way that is kind of increasingly convenient and personal to the individual patient. Can move to the next. Mm-hmm. But there's a long way to go. As Rody was mentioning, there's a lot of bad kind of apps out there. There's a huge proliferation of different platforms. There are, there's a lack of integration between all these systems, and so this kind of promise of this end-to-end experience it hasn't really been delivered on yet. And so, this really doesn't quite resemble that seamless patient experience that patients are going to expect just yet.
Yeah, I think that's right. I think some of the biggest challenges are that not being integrated, right? So it's too just disjointed, which is a broader problem across healthcare, and then also not being local. So as much as talking about these digital tools, health is also a very personal thing, and so that personal connection at times is also an important part of the journey and important part of the process. And some of the most successful interventions combine the digital and the physical. And so that, again, leads us to our next topic, which is opportunities for retailers. Because it's one thing that's really true about retailers is you are local and you are physical. And so you have the right capabilities to step in. And that's kind of the key point here. The reality is, if you think about how often a patient goes to their doctor versus how often they go to their pharmacy or their grocery store, the frequency is key, right? As we think about lifestyle, it's all about building behaviors, building habits, and you're already a part of those habits and journeys. So how do you start to engage them in the health discussion in a way that supports them on their journey, but also ensures that you're not supplanted from another solution or another retailer or a digital omni-channel solution? And so retailers are well positioned to really play that piece. And in fact, we've seen retailers try to do this in the past, and not a lot of success. But there's a couple of things that are changing, I would say. So, a good example would be grocers and dietitians, right? And so, was it 10, 15 years ago that was kind of all the hype and everyone was getting excited about it? Everyone except for the customers, which is the challenge. And it's so often the case. It wasn't that was wrong. It's just that we got ahead of the customers. But the good news is the customers are catching up to us. And so, models like the dietitian in the grocery store is now a real opportunity. But that can't be the only part of it. That's got to be part of a more holistic solution. So we also need to design and rethink a little bit how we manage programs like that. But there's real resonance with patients and with customers in terms of delivering those pieces locally in our stores, right? Similarly, like, how do we think about our pharmacies in our stores, and how do they play a more integrated role in supporting health, not just making sure people are adherent to their medications, which is obviously critically important, but there's so much more that we can do, and that there's a lot of value in terms of driving that engagement.
And as telehealth advances, retailers can play there's a lot of different opportunities for retailers to play a role. As consumers embrace kind of the telehealth delivery of services, there's a whole segment of population that doesn't have access or connectivity to an internet capable computer or smartphone. I'm sure everybody has seen, the stories in the news over months about, school kids who don't have access and are going to retailers or local restaurants to, jump on their Wi-Fi network. That actual connectivity is a huge opportunity, and especially as Rhodey was mentioning, that the retail networks of pharmacies, of groceries, of other types of retailers is a huge asset in being able to provide some of that connectivity, as well as support for access for those that, it might not be, they're not a digital native. They might not have the, kind of inclination to do a telehealth visit, but it might be, a better solution for them to get access. It might make the difference between seeing a doctor and not seeing a doctor if they can do that in a local setting close to their house. Yeah. And because patients trust their pharmacists, it really, makes the pharmacies in your stores very well positioned to help make that connection and make that kind of an easy and seamless experience for those that might not typically gravitate towards that channel.
Yeah, and Katie, just to add on to that, I think we've seen some retailers experiment with this in terms of like a virtual clinic or like a telehealth room and not had terrible success. Well, the reality is COVID changed that, right? People are are more used to it and quite frankly, might even prefer it to some of those in-person visits. So how do we, rethink some of the things that may have not worked in the past, given where patients and consumers are today?
Yeah, absolutely.
And then I think the other piece is around lab and testing. I was just looking at some data, and 50% of customers that are patients and customers that we surveyed would like to have more labs and tests in the retail setting. Right, and so that's really interesting to me, because I think the old idea of, I don't want, my medical stuff happening at the grocery store, some of those old walls are tearing down, and they're tearing down for a couple of reasons. One, I think that there's more trust in those retailers and those pharmacists, for example. And two, people care about convenience a lot more than they've ever have. And that kind of local convenient care is kind of trumping some of their other concerns.
Yeah, and that definition of convenience, as it's changed, it used to be that you would go to a medical center and you expected all of those services to be kind of around your doctor's office, and it'd be something, you take a day off and you get everything knocked out that you need to get knocked out associated with your visit, and you want to kind of get it all done before you go home. But the reality is today that you may be doing, more remote touch points with your doctor through the telehealth channel. And so your definition of convenience is different. It might be, a model where, you actually go into your local pharmacy or to a local retailer and get each of those different services, because it's, that's 5 minutes from your home versus driving, 20 minutes, an hour to your doctor's office to get those follow-up services. And retailers are incredibly well positioned. The experience that you all have with delivery and digital self-service are beginning to build, especially in the wake of COVID or in the middle of the COVID experience. These are a huge asset in being able to meet the needs of customers. These behavior changes are going to be long lasting. This has really been kind of the tipping point to try a different model that I think, has been contemplated for a long time, but really hasn't gotten that customer adoption. And so, people are getting very comfortable with receiving things at home, doing things, via video screen that we would have done in person previously. And it's here to stay. We've done a little bit of research with some different patient groups to really understand what their expectations are. And 70% of patients expect a delivery in 3 days or less when it comes to having prescriptions or medical products delivered. This is really, the Amazons of the world and our the Targets and the retailers who are really, delivering on, that quick turnaround from order to delivery. They're really setting the expectations with the patients, and that's carrying over from the retail world into health. We've also identified that about 50% of patients are willing to pay for an expedited delivery, and kind of testing, different price points. The sweet spot's usually around, between $5 and $10 for those that are willing to pay. And then, of course, that patient experience, really that end-to-end kind of retail experience, translating that over into how you actually order your prescriptions or order your products, and having different optionality, all the way to scheduling an appointment. People and really make this kind of easy and seamless, and something that they can that's very accessible to them. They don't want to call a call center and find an appointment, and they want to be able to geolocate their closest location and really get in that day or fairly quickly in order to get that care delivery experience. And that digital engagement piece, retailers are actually, you guys might think that is something you've struggled with or you don't quite have nailed yet, but you are light years ahead of our hospital systems in that regard. So definitely somewhere where you have a leg up.
Yeah, I think that the other point I'll underline there is the optionality and choice. We talk a lot about delivery because that's the one Amazon does and we all know and love. But if we look at kind of omni-channel growth through like pre-COVID and through COVID, the fastest growing elements have been BOPIS, buy online, pick up in store, right? Which is an interesting, juxtaposition, right? Like some customers are willing to pay for delivery. Other customers are fine to drive to the store, provided it's convenient and local, to pick things up and kind of do their part to offset the cost. So that provides some opportunity as well for retailers to think about what's the role we play and what are the solutions and options we provide to customers. And as you think about health, some customer segments really, one of the reasons they don't go to prescriptions by mail is because there's some, fear. Like, what if it doesn't arrive on time? What if I don't get my medications? And like, health has a lot more anxiety associated with it than, my latest purchase from Walmart.com or Amazon. And so that BOPIS becomes part of solving some of that anxiety for a sizable portion of the customer set.
All right. So what? How do we actually make a change, and how can retailers really capitalize on these opportunities? We've gone through and kind of identified a few different case studies to kind of walk through and learn from over the next few pages. The first one is Walmart Health. And what you see here on the screen is kind of one of the standalone retail clinics, really focused on primary care. They've got counseling, lab, and X-ray, and hearing, and optometry. This is a great example of co-locating the healthcare services with a retailer that most Americans visit once a week or very frequently. So really something that is incredibly convenient, both from a kind of a buy online or pick up opportunity, and having that co-located with your services, and it just being an additional stop that patients can make as they're going through their day-to-day. Really super convenient option. One of the kind of keys to making all of these different pieces and delivering work and delivering on that seamless promise is the integration between the actual providers and the payers and the clinic themselves. And we see Walmart introducing Walmart Insurance, right? And really moving to this kind of overall integrated model. There's a huge opportunity here, and lots to learn from as Walmart kind of explores this different space.
Yeah, and I think a couple of points here. One, there's obviously the opportunity to expand your service set, expand your share of wallet by moving into the health space. But also from a retailer standpoint, this becomes a traffic driver. This becomes another reason, another convenience point for choosing your retail location versus another retail location. And so thinking through that, right? And not all retailers have to do health. There's partnerships you can pursue with your local hospital systems, with your local providers, to build something that could be competitive or similar, meets those customer needs, is convenient, and also becomes a traffic driver. Also allows you to position yourself more in their health lifestyle. So some key learnings there. Obviously, not all of us have the pockets of Walmart, but there's definitely a lot of innovative ways to meet the same customer needs. Speaking of innovation, one of the things I talked about earlier is my kind of digital health journey and using Noom. Headspace, I'm just plugging all the apps I use. I also use Headspace. I don't know if anyone else uses it, but it's like Calm. It's one of these micro meditation type solutions to help mindfulness and kind of there's a sleep program, focus, etc. And so one of the interesting experiments that we've seen is retailers starting to partner with some of these digital health companies. And how does that show up? So Boots and Headspace partnered in the UK with Boots bringing Headspace into their store, right? So there's a display in the store, there's gift cards that you could buy to give to people or to use for yourself to access Headspace. They trained some of the staff in the store to be able to speak to Headspace and kind of the opportunity and really start that mental health conversation. And then obviously there's a commercial arrangement there, right? So what I love about this is you're starting to see those digital companies trying to move into the physical. And that's an opportunity for all retailers, right? To be thinking about who are those digital companies we can partner with. The other piece is you're also seeing, retailers leverage some of the credibility and some of the conversations that those digital apps are having to have in store, right? And credentialize themselves as your mental health partner, your broader health partner. So I think there's a lot of opportunity to continue to explore some of these kinds of partnerships. As a way of customer acquisition for the digital companies, but also as a way of credentializing and building business for the retailers. And then the last example, this one's kind of fresh off the presses. You might have saw an article in CDR about this PC Health, which is an app being launched by Loblaws and Shoppers Drug Mart in Canada, grocery store, large retail pharmacy. And it's focused on really broadening the health conversation with their consumers digitally. So how do they do that? One, personalized welcomes. You load up, has some offers for you and some activities. Lifestyle programs for points. So they have a very robust loyalty program. It's something like half of Canadians are engaged with the loyalty program. And so they've crafted programs to earn points, right? So different topics talking about holistic health, seven days to hydration. So you can kind of pick your health journey. Some of them are more physical, some of them more mental, some of them more diet. And then basically you have an activity every day. And this again, goes back to that whole building lifestyle. And so every day, like my activity for tomorrow is smile and apply the facial feedback hypothesis. That'll be interesting to learn about. And I'm going to get 35 points for doing that. So that's part of how they drive that engagement. And as you kind of move into this digital space, that engagement is so important. Also solving needs, so getting care. We see something similar with Find Care from Walgreens, like helping consumers meet those needs. Oftentimes we don't have the information to know what kind of doctor we should see. If we're having a certain issue, what's the cheapest, most efficient way of addressing that? And so these kinds of get care solutions can not only help lower the healthcare costs, but they can also make it much more efficient and easier for people to get the care they need sooner. It's also a great way to link some of your programs, right? Here, diet, nutrition. If I clicked on that, I'm probably going to be talking to a Loblaws dietitian in a grocery store. Which is very real and very focused on food. And then the last area is shop, right? So pulling together the commerce, and you can kind of see there's a lot of health-oriented shop items. But the idea here is building this database on information and providing you with offers, right? So you can probably see down here across the bottom of these screens, there's a place, My Health. There you can input your information, like what's my age, what are my health conditions, what are my weights, what are my goals, and those offers start to become customized for those. Loblaws and Shoppers and all retailers are still at the early days of figuring out when and how can we use health data to really provide personalized offers across the store, right? And so what does that mean? So if I'm diabetic, when can I use that information to provide you with items that would be advantageous for you from a diabetic health standpoint, right? So no sugar, low sugar type items. And the reality is no one's really crossed that barrier yet for a lot of different reasons, but everyone's approaching it. And the reality is consumers, as we survey consumers on data and data privacy, they're okay with it if you give them permission, right? So they need to have the ability to control whether or not you're able to use that information to give them offers. A good proportion will opt for it, provided they see the value in the offers that they're getting. But there will be some that never will, that will never kind of give you that permission, and that's okay. And so it's about empowering consumers with that data, with those controls of that data privacy, and then really living up to it. So that's kind of the next place where we'll see kind of retailers moving as we kind of see the continued evolution of healthcare transformation and how it shows up for retailers. Perfect. Good. So with that, that's the content we wanted to discuss today. So, thank you for joining. Keith, I'll hand it over to you.
Oh, thanks, Rhodey. And Katie, thank you very much for this great information today. The one thing I heard probably more than anything is we've always thought about the store as being the main part for the healthcare connections, but I think your discussion too of how you bring digital now into that play is becoming a big part of it. And we always call it, there's all these new uncommon partnerships that we haven't been thinking about. Do you see that as probably being the biggest opportunity, Rhodey and Katie, or do you see other areas being the first step a retailer should start looking at?
Yeah, so I think uncommon partnerships is key, because the reality is, one, not all retailers can do this themselves. Two, if you're doing it, it's probably going to take you a lot longer than if you did it through partnerships. And, as we kind of talked through, like with COVID, there's no time. We're already behind the consumer. And so the need to move quick requires you to think about those partnerships and how do you leverage them? How do you leverage them to accelerate? So I think that's mission critical. I think thinking through the overall customer journey between digital and physical is super important, right? So as a retailer, that's what I'd be figuring out. What's the kind of that whole journey and experience I want to deliver, and then what should I own and do versus what should I be partnering to bring into that?
Terrific. Well, I can't say enough again for the partnership that we have with Kearney. Rhodey is a part of the GMDC Education Leadership Council, and Kearney's been an active participant in not only the roles retailers can play here in health and healthcare, et cetera, but also within our GM and health and beauty and wellness space. So again, Katie and Rhodey, thank you for your time today. Please feel free to reach out to Rhodey or Katie at any time, or any of the individuals at Kearney. And I want to thank everybody for joining us today. Have a terrific day.
Perfect. Thanks.
Thank you.